much. Thank you, Catherine. And Save the Children Nepal Country Director Tara Chetri joins us now from Kathmandu. Good morning to you, Tara. 6 a.m. Kathmandu time. It's been 24 hours almost since the devastation struck. How are people in Nepal waking up to what has happened?
Devastating, of course. I don't think anybody has slept. Night's been horrific. So the death toll is rising. As I'm speaking with you, 157 has been reported so far. Thousands are missing, unaccounted for. So yes, terrible.
What is your understanding of the devastation, the physical devastation to the infrastructure, to the towns?
There's nothing left now. If you look at the pictures, I mean, it's coming in. Water everywhere, dam, electricity, authorities, houses, bridges, roads, everything has been swept aside. So literally nothing there.
Has Save the Children before had to deal with an event of this scale in the area? Yes?
Not in the area, but 2015 earthquake, and then 2025 another earthquake. So yes, and every year we've been responding to the floods at this season.
So what are the most urgent humanitarian needs right now that Save the Children will be looking at?
Of course, the assessment is very important, but this has to be done simultaneously with the response. So our team is already on the ground together with Red Cross. Within 24 hours, we've been able to provide support. So the assessment is undergoing because we really need to understand how much it has affected the children, because we are extremely concerned about their well-being, because they've been displaced, they've been hurt, and we also do not know their exact data. And the response that we are providing is water, healthcare, protection, and kits, shelter. Everything has been loaded on the truck and already has reached. And from this morning, we will be distributing. And our intention is to distribute or at least respond to 1,000 households as soon as possible, which starts from now.
How have your teams managed to get into the area? Because we hear about so much of the infrastructure has been damaged, the roads, the bridges, etc. How challenging was that for your teams?
It was quite challenging. They reached. It took us like 5-6 hours to reach the destination. But
and is that Rasawa?
It's in Bidu right now, but they are now for the response. They're relying on the government helicopters and the other transportation means to transport their response materials to the places.
What is your understanding of those people who have survived the landslide but yet are isolated? How long is it going to take to reach those people?
So, it's very important to assess where they are. So for many, it'll take days. So that's why, where they're located, it's so scattered, and the situation, the way things are right now, because of the access, everything's been destroyed. So whoever that could be, transported via their choppers we've been able to take them to their safer locations. But for others, there's no roads. Even the walking is almost impossible. We're looking at days.
Well, what are the key areas of focus? Where are the areas the people that you are trying to get to immediately?
The area of focus, of course, the health sanitation is very important. We have to get them their healthcare as soon as possible. Injury is what we're looking at. And then food, shelter. Everybody is displaced. So we need to take them to a safer location and then take it from there. So that's why, like, even from kitchen utensils, of course, the priority of the health facility supplies, but then the other thing is equally important. So that's why the shelter kits is the topmost priority for now, right now.
Sure. So these are addressing very key, practical, essential and tangible outcomes. What about when it comes to the psychology for children? Not have they maybe lost their family, but they've witnessed such devastation?
Of course, this is what we are extremely worried about. And that's why we are now keeping our teams and the experts on standby, especially for the mental health issues, because now they are already displaced. They're separated from their families. So yes, so we are on the standby. We are coordinating with the support that they require, so that we can connect them to them immediately. And we are also working with the government so that support also gets a top priority along with the other responses, so that this particular need is taken care of immediately.
Given the scale of
Yeah.
this, Tara, what if the international community was listening to you, what would you say? What help do you need?
I think first of all, we need to come together as a team. This is a time where because the information is so much important. So we've got to work with the government. Of course, the appeal has been there. So this is what we're doing. We've already provided what we have to the government, saying this is what we have in our stock. For example, the warehouses, what sits there, how much we can support, and similarly the others, so that they have a sense as what they can expect from the international communities on the ground. And then what else? What are the gaps that exist outside the support that the government has, of course, including the expertise, of course, how much they can respond to. As you see, this is massive. It's a lot of work for all of us, but then this is the time where we need a lot of solidarity, standing together, and then of course be transparent how much we can do together, and then also ensure that we support on the ground.
Save the Children Nepal Country Director Tara Chetri joining me from Kathmandu. I wish you all the very best over the coming days.
Thank you.